On April 14th of this year, two subsidiaries of a Tennessee-based company, Surgery Partners Incorporated, finalized an agreement to pay the federal government $41 million to resolve accusations of making false claims by billing Medicare and Medicaid for medically unnecessary urine drug testing. In a news release, a federal investigator wrote those scheming to enrich themselves at the expense of taxpayer-funded programs must be held accountable for their actions. But less than 1 month later, the company reported the same federal government gave that same parent company, Surgery Partners, a loan through the CARES Act, $120 million, and a grant payment of $45 million that doesn't have to be repaid. Attorney Vince McKnight has spent 25 years representing whistleblowers in false claims cases and questions who got the money and when.
Shouldn't you have some time in the penalty box or something when you've done something wrong? Shouldn't you perhaps be excluded from the largesse of government contracting for some period of time, when you have committed these egregious violations of fraud? But that's not what happened.
Our analysis of data collected by the D.C. nonprofit Good Jobs First found 225 companies that paid the government for false claims-related cases in the past 10 years received at least $4.5 billion in CARES Act loans and grants.
There is some questions about their practices, and they do deserve extra scrutiny.
And those same companies that got $4.5 billion in stimulus money have paid a total of nearly $13 billion in false claims money since 2010.
I personally think that we should be screening the recipients because I don't think that fraudsters should pay the government on one hand and then come back and get the money back on the other hand.
McKnight represented a whistleblower who filed a federal False Claims Act case against Tenet Healthcare, a company that's paid hundreds of millions of dollars in false claims settlements in the last decade. In February of this year, Tenet agreed to pay $1.4 million to settle one case. But less than 3 months later, Tenet reported in its SEC filings that it received $1.5 billion in CARES Act advanced Medicare payments, and this month reported another $712 million in cash payments.
It doesn't make sense for you to have, say, within the last 5 years, have resolved over $100 million of settlements with the government and then turn around and get forgivable grants that exceed $100 million in the next fiscal year.
In a statement, Tenet told us the grants help them serve patients, minimize financial impacts, and said the funds are only used for COVID recovery and assistance. Ohio Senator Sherrod Brown says the government must do a better job doling out this public money to companies with questionable track records.
They should be disqualified if they've cheated the government.
We found 80% of the companies, both prosecuted and paid, are related to health care.
If you're a big hospital or any healthcare organization and you've defrauded Medicare and your executives have benefited from that, you shouldn't be getting federal money. You should be paying a penalty and a price for the corruption and the greed.
Here's another example of a company paid millions only to turn around and get millions in emergency relief. On April 30th of this year, Florida cancer specialists agreed to pay a $100 million criminal penalty for participating in a criminal conspiracy. Less than 2 months later, the same federal government gave that same company, Florida Cancer Specialists, a $67 million grant. Money the company reiterated to us that it did not ask for. Just another example, though, of the government voluntarily sending money to companies that recently paid up.
It does raise the question of whether there should be additional scrutiny of these recipients to make sure that there's no more kind of misconduct or billing irregularities going on while they're getting this vast amount of federal assistance.